Hi there, it's me, Dr. Kular at Life with Dr. K. Today I have the founder of Zen Babies Massage, Colleen Fay, who's here with me, and she was kind enough to come a second time because we had recorded this yesterday, except the volume wasn't on, so she was very nice to come back again, and we're redoing this video just for you because of the importance of it. So I found her and heard about her through a mutual friend who told me that she knows a wonderful woman who knows how to do infant massages. That was very intriguing for me because I don't know many people in the Western culture who do know about infant massages or who do infant massages. So I had to meet her. So here she is. So she's going to talk to you about what the purpose is of infant massages or what are the benefits of infant massages. Colleen, thank you so much for coming again.
It was such a pleasure. We'll be professionals by the time. People will be hiring us to do their videos.
Yes, exactly.
Well, infant massage has many benefits. It can stimulate, it can relax, and it can reduce pain.
Yeah.
In a typical class, for instance, I teach parents through very easy to duplicate massage techniques to deal with very common baby issues, whether it's the pain of teething, gas, constipation, or just prepping for a good night's sleep.
Wonderful. So, and those are all very common concerns and complaints that a lot of parents have, and they don't know how to deal with it. Besides just infant massages, what other techniques do you do, along with infant massages?
Well, part of my infant massage, I also know reflexology. I'm trained in medical massage and shiatsu. So I tend to, in all the years of my experience, add a little, take away a little, contribute to any of the issues you might have with your baby. I work well with chiropractors, pediatricians, and so forth. So I have a lot of background to pick from.
Wonderful.
In dealing as a massage therapist with infants, one of the benefits I found to be really just so amazing was with a premature infant.
Mm-hmm.
Some people ask me, how early can you start with infant massage? Is it only, for instance, is there an age gap or a stop time? And really there isn't. My son's 27 and I still work on him. But with when you start with a preemie, they found that infants who are massaged 15 minutes a day, a few times a day, have a 47% higher weight gain than babies who are not.
Wow, that's very
So
interesting.
it's really helpful, especially in the case of a premature infant.
And how young can you start working on infants for massages? How old do they have to be?
They can be newborn.
Okay.
I've had lots of experience as a retired doula where we initiated massage right after birth.
Okay, and just like you said, it helps with bonding, it helps with lymphatic flow.
Yes, it does.
And it also helps mothers as well, too.
Yes, there's statistics that show the connection, the bonding made between a mother and baby immediately can aid in preventing depression.
Wonderful. Is there a certain technique, because there's a lot of these massages, we see a lot on YouTube, we see a lot on Google, and a lot of my families do like those websites. So, is it easy for anyone to understand? I mean, how should you know to trust a person with your baby for these massage techniques?
Well, you always want to make sure they're certified.
Yeah.
Okay. If you're watching a YouTube channel and whoever the instructor is not addressing contraindications,
Yeah.
And the way the area should be prepared for a massage,
Mm-hmm.
whether it's asking for permission to massage,
Mm-hmm.
making sure the baby is healthy and able to receive the massage.
Right.
So check their credentials. It's easy for anybody to get on and do a YouTube
Mm-hmm.
instruction video. But it's really important to call them. If you have any questions, I'm always open to discussions if you need any help in figuring that out.
Okay. And I see this oil bottle right here, so I'm guessing this is what you would use for an infant massage. What exactly is this?
Okay. As long as it is edible,
Yeah.
and it has no fragrances, synthetic components, you're fine to use it. Literally, you can go into your kitchen
Mm-hmm.
and get your, cold pressed olive oil
Mhm.
and start massaging your child. And it's done. I do it that way because I find that babies put their hands in their mouth a lot,
Right.
and their feet and their toes and whatever else they can get a hold on.
Yes.
But if you're not, you don't need to be concerned when you're using something edible on them.
Okay.
So it's also good because with your skin being the largest component of your body, your biggest
Mhm.
organ,
Mhm.
everything's absorbed into it.
Mhm.
So you want to make sure that what's being absorbed into their body is healthy.
Right. And there is an umbilical stump that's in place, especially with the
Mhm.
newborn babies.
Mhm.
How exactly do you recommend, or how do you exactly do you go about doing the massages? Do you put a gauze there? Do you just avoid the spot?
If you need a reminder, yes, I would put something over there that tells you don't want to go into that area until the stump is healed and falls off.
Okay.
Also, what you would not want to do is pull the skin away from that stump.
Okay.
So you would want to do things that are just circling it, or in relaxing the diaphragm, as in a gas technique. That would just be a hand over hand procedure where you just be relaxing under the rib cage, and then you can go around the umbilical
area. Okay. Is there any reactions that could happen from this oil?
Not usually from a organic olive oil. I would stay away from nut oils because you're not sure yet at this young age if there isn't going to be an allergic reaction.
Okay.
You can put a small amount if you feel necessary, maybe on their foot, to see if there is anything that occurs before you put it on their entire body.
Okay.
But I have not come across yet anything around an organic edible oil.
Okay. And what time of the day do you recommend to do these massages? Before a feed, after a feed? What is the time difference or the gap?
I'd wait an hour or so after feeding.
Okay.
You want to make sure that things have been digested, so you don't cause any, stomach aches or regurgitation of food.
Okay.
They want to be comfortable and full,
Yes.
so they're kind of satisfied. A great time of day is what we call quiet alert, where they're playful and interacting with you and giggling and very receptive to having you interact with them. I would not do anything that is of stimulating nature late in the day or close to bedtime.
Okay.
I would try to keep those massages, which are also included in my instruction, which is a calmer, different style massage than when you're trying to accomplish something.
Okay. And you also don't want to do these stomach massages later on in the day.
No.
So you want to do them.
I would do them. I tend to have my instructions in the morning. 10 o'clock seems to be a good time for moms most of the time,
Okay.
or maybe a little later, mid-afternoon.
Okay, perfect. So besides, you were doing a little technique with the gas, because a lot of parents come in concerned around week 2 to week 6 that my baby's very gassy. They ask me about certain ways that they should do massages or bicycle the legs, or about gripe water. So you're showing a little bit. Could you do a little demonstration of what exactly would help them with a gassy belly?
Usually, just as with an adult, when you feel gas or digestive issues, it's usually high, right under your rib cage. You feel that pressure where maybe you can't take a deep breath, or things are uncomfortable.
Right.
And we always say gas.
Yeah.
Well, a baby experiences the same thing. So what I would do is I would start the massage by relaxing under their diaphragm.
Okay.
I'd start to the sides of their rib cage, not directly in the center, to avoid what's called the xiphoid process. So you want to relax, doing quiet, easy massages with their breathing. Okay, you want to regulate everything at the same time where it's nice and easy and calming. You can do some movement. You want that gas to start to move around and eventually be eliminated.
And you also do constipation around that
Yes.
area too, for varying ages.
For varying ages, yes.
Okay, wonderful. And the other one that is really big with a lot of parents that they're concerned about is fluid behind the child's eardrum. That could be from just nasal congestion. They obviously can't blow their nose, so it gets retained. It does cause irritability. It can happen from teething as well too. Depends on the time of the year. you do have some techniques that you use for that as well too.
During teething, babies usually have a lot of excess fluid. It's called wet teething, and it can accumulate in their sinuses and so forth. It also, during a time maybe with a cold, congestion, again, there's excess fluid. What you usually want to do in that case is you always want to move from midline out, okay? So you would be draining, working their sinus cavities, coming across their cheekbones, out to the ear, maybe a little massage around the TMJ area. I would do all massage around their ears, a little tugging.
Show them that too.
Oh, okay. A little tugging on their ear lobe, okay, to open up the canal. Kind of when you have water in your ear, you want to stretch it out and move it around. But you don't want to stop there. You want to continue to have that fluid flow out of their ear canals and then down into their lymph nodes. The lymph nodes should be activated regularly. They're right in the armpit. We actually refer to it as the pit stop. And you'd want to do some massage in there. Reason being, your lymph nodes are kind of like the garbage pit of your body. So you want all of the things you don't want in your system there. Break it all up and then have it dispersed through your body and have it eliminated. But it's very easy to just, like I said, come across the forehead, come across here, down. There's a whole little technique we go through, but this is pretty quick and simple. And then their ears, but you always want to remember to drain the eustachian tube out and then down into the lymph nodes. Also, at any time with chest congestion, moving from midline out again into the lymph nodes will help break that up.
Disperse the phlegm and the congestion that they have. And the other thing that you were saying that you do with some babies too is for sleep. You have particular kinds of massages. I know you were saying you like to do massages in the morning, except the one that is for sleep. So
now at night, again, it would be something that would be, and I'm going to turn this little guy around, these strokes would be much wider. A smaller stroke is stimulating. With a baby, you want to have everything be calm. The strokes are longer. You can continue them down into their legs. Okay, even when they are resting and getting ready for bed after a bath. Any of the strokes you do, you want to be elongated and relaxing. Okay, usually when I do this, everybody's yawning by the end of the demonstration because the whole aura changes. So there is a big difference between what I would do to eliminate constipation and a big difference with what I would do to have a restful night's sleep.
Essential oils is really big with a few of my families. Would you add any essential oils for that nighttime or particular types of massages that you do?
You can. There's a lot of controversy about using essential oils on infants. I would never use it directly out of the bottle. I always use maybe a drop in my hand with a carrier oil, we would call it in that case, which I would still use the same organic massage oil. And basically I would only do it on the bottom of their feet. Now, it works good because the bottom of your feet in reflexology and shiatsu, acupuncture, and so forth, a lot of the points of reference for the rest of your body are on the bottom of your feet. I would not put it anywhere on their hands where they could put it in their mouth, and not on their chest where inhaling might be too strong. So I'd put most of the things that I'd want to try on the bottom of their feet.
All right, wonderful. Is there anything else that you would like to say before we wrap up?
Just that in all the years I'm doing massage therapy, the thing I find that brings me joy is when I see parents make that connection. When that bonding, when they see that smile, when they start to enjoy each other is really heartwarming.
Right. So we enjoyed hearing this, learning about this, but I'm sure you guys are going to have some interest and you'll want to share this information with others. We're going to post Colleen's information for Zen Babies and her contact information below. If you have any experiences with infant massages or if you have any questions for me, please write some comments below and I'll respond back to you guys. If you like this video or other videos that we have, please like and subscribe. Thank you so much, and we'll see you again. Take care.
Have a great day.
Bye.